Hey, everybody, welcome to another edition of our YouTube live videos. Again, all available through our website at thenutritionshop.net. Click on the link on the top page, and you can be a part of our YouTube channel. Today, we're going to talk about calcium supplements, and I'll say this. In my history, going back in pharmacy, if I go back into when I first opened my first pharmacy back in, I think, 1987, 88, calcium supplements required a prescription. That's where we started to use calcium lactate. And doctors would write a prescription for this, and you'd go in and get it filled. Take one little calcium lactate pill a day. Then came the dawn of the 90s and the 2000s when we started to pay attention to women's bone health and children's bone health. And we started to find out the role that calcium played there, supposedly. So we started out 600 milligrams of calcium every day, all the time, was a great idea. And the preps that we had really weren't that good. We had various forms of calcium that just weren't absorbable. Then came calcium citrate. We had oyster shell calcium. We had numerous. So in the early 2000s, this thing blew up. And doctors changed their course and said 1,200 milligrams of calcium every single day. Then came the concept that, when we've given our kids in grade school the little containers, the little small containers of milk every day, government supplied milk, that it was an extremely important part. We gave it to the kids every day with their lunch because that milk, just in case you couldn't afford to have it at home, that milk supported calcium coming into your child. Now, fast forward to the 2000 teens, and back in about 2015 or 16 came out the report that says, that little container of milk that we gave our kids actually didn't supply any calcium. Even though it was calcium fortified dairy products, it didn't really supply anything because it became so acidic in those little kids. And a lot of these kids developed sensitivities to dairy over time. We ended up depleting calcium out of our systems. So that fell by the wayside. Now comes this new piece that said, we have recommended forever to tell every woman when they went in to see the doctor during their OB/GYN exams, take 1,200 milligrams of calcium. A new review suggests that calcium and vitamin D supplements have little effect in increasing bone density and preventing fractures. Little effect. Mark Boland, an associate professor at Auckland University's Medical and Health Sciences faculty, most recently co-authored with longtime collaborator Ian Reid, a professor at Auckland, a systematic review in the Medical Journal of Australia. After reviewing the evidence of both efficacy and safety of calcium and vitamin D supplements, the paper bluntly concluded that while vitamin D does have a place in the prevention of osteomalacia in individuals with specific risk factors, calcium supplements have, quote unquote, very little place in modern medical practices. I've been saying this for years. I'm getting feedback from doctors saying, how dare you tell my patient to stop taking their calcium? And I'll go into that in just a minute. The use of calcium supplements in individuals without specific bone pathology does not have a sound evidence base, and safety concerns suggest that the net effect could be negative. Not only didn't it help, it actually could hinder, said Dr. Reid and Boland. Calcium supplements, they wrote, are frequently associated with gastrointestinal symptoms, particularly constipation, and they've been reported to double the risks of hospital admissions related to abdominal symptoms. In addition, they found calcium supplements to be frequently associated with gastrointestinal symptoms, particularly constipation. These have also been reported to double the risk of hospital admissions. Boland said the findings had not so far come under fire. Quote, this time I think no one has really had any criticism of what we found. It's been quite distinct change compared to what people have been saying previously, Boland said. Perhaps time has passed And people are looking at the evidence for themselves and came to the view that it's pretty clear that there isn't much role for calcium in medicine today. Last year, Bolin co-authored the largest meta-analysis of its kind to date of 81 randomized trials, which concluded vitamin D supplements do not prevent fractures or falls or improve bone mineral density in adults. Now, let me comment about that. That article, and I pulled it up, far undershot vitamin D. To be therapeutic, your vitamin D levels in the blood must be in the 70s to help improve bone density. They didn't do that in that study. They looked at between 400 and 800 IUs of vitamin D a day, and they saw little effect there. Well, of course, that's a pediatric dose. Bolin's work in this area started at a time when calcium and vitamin D were routinely being prescribed around the world for the prevention or treatment of osteoporosis. Over time, calcium scripts have become less common, at least in New Zealand, but vitamin D continues to be widely recommended by doctors. Bolin said the support of these medications were a scientific dogma for the last 30 years or so. A lot of people struggle to understand why we say you don't need to take it. The reason we say this is that the clinical trials that have been done show you don't get benefits from taking calcium supplements, and we should stop prescribing them routinely, Bolin said. Australian researchers in particular had openly and loudly disagreed with the findings of Bolin and his colleagues. So it's interesting that some people, in response to the latest review, now say otherwise healthy people don't need to take calcium. Still, I've also seen some comments emphasizing that for people with osteoporosis, you should still be prescribing the supplement, which is quite different than what we said in the review. Medical Journal of Australia. This came out in December of last year, actually. I've been carrying this for a while. And we're going to file this under osteoporosis in my files in the back. So we'll file this under bone health, a crucial update. Now, let me say this also. One of the reasons that calcium came under scrutiny is that we're now finding it becoming more of a cardiovascular issue. That we're actually seeing precipitation of calcium on the outside of the arteries, causing stiffness of the arteries, over and above that of cholesterol internally. So, truth be told, keep up your vitamin D, have your vitamin D levels checked. And Chris and I here in the office were just talking about how important is it to be able to have your hormones checked if you're a female. Critical. Just printed out an 18-page research piece that was done on progesterone being the bone trophic hormone. Get your levels checked, get them verified, and if necessary, turn around your bone health by using that extremely safe bioidentical form of a hormone, progesterone. If you have questions about this, maybe comments on this, give us a call here at the office, 678-228-8900, 678-228-8900, or reach out to us through the web at thenutritionshop.net, thenutritionshop.net. Tomorrow, we're going to follow up on this vitamin D idea. Low vitamin D during pregnancy linked to ADD and ADHD. We're starting to find more and more research on some of the causative factors about why these kids nowadays are becoming attention deficit hyperactive. So we'll delve into that tomorrow and much more. Again, the number to reach us here is 678-228-8900. God bless you, folks. See you back here tomorrow. Take care.